If you are new here, be sure to subscribe to this channel and turn on your notification button.
What you should know about depression. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest, also called major depressive disorder or clinical depression. It affects how you feel, think and behave and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life isn't worth living. Depression isn't a weakness and you can't simply snap out of it. Depression may require long-term treatment, but don't get discouraged. Most people with depression feel better with medication, psychotherapy. While everyone experiences sadness of a loss or disappointment at certain points in life, a surprising number of people are affected by major depressive disorder, an unrelenting form of sadness and despair. The statistics are staggering. According to the U.S. Centers for Disease Control and Prevention, CDC, 1 in every 10 American adults say they have depression. According to the National Institute of Mental Health, NIMH, 6.7% of American adults have MDD, or major depressive disorder, during an average year. The Depression and Bipolar Support Alliance states that depression affects more than 23 million Americans every year, and that it is the most common serious brain disease in the United States. Numbers from the World Health Organization estimate that about 350 million people have depression globally. The number of people with depression may be rising due to more awareness and more acceptance of depression as a disease. Major depression is more than just feeling low. It is a real disease that runs in families and meets accepted diagnostic criteria. What are the symptoms of depression? Symptoms of depression may include: Number 1. Feelings of sadness, tearfulness, emptiness or hopelessness. Number 2. Angry outbursts, irritability or frustration, even over small matters. Number 3. Loss of interest or pleasure in most or all normal activities, such as sex, hobbies or sports. Number 4. Sleep disturbances, including insomnia or sleeping too much. Number 5. Tiredness. Number 6. Reduced appetite and weight loss or increased cravings for food and weight gain. Number 7. Anxiety, agitation or restlessness. Number 8. Slow thinking, speaking or body movements. Number 9. Feelings of worthlessness or guilt, fixating on past failures or self-blame. Number 10. Trouble thinking, concentrating, making decisions, and remembering things. For many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activities, such as work, school, social activities or relationships with others. Some people may feel generally miserable. Who is at risk of depression? Depression is twice as common in women as it is in men. A big part of that is due to female hormones, but you also have to take into account that men are less likely to report depression, and women are more likely to admit to depression, said Dr. Walsh. Factors associated with depression. Number 1. Age. Major depression is most likely to affect people between the ages of 45 and 65. People in middle age are at the top of the bell curve for depression, but the people at each end of the curve, the very young and very old, may be at higher risk for severe depression, says Dr. Walsh. Late life depression affects about 6 million Americans. Number 2. Biological differences. People with depression appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Number 3. Hormones. Changes in the body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result with pregnancy and during the weeks or months after delivery, postpartum, and from thyroid problems, menopause or a number of other conditions. Number 4. Inherited traits. Depression is more common in people whose blood relatives also have this condition. Many studies have shown that depression can be passed down through families. If you have an identical twin with major depressive disorder, your chance of having MDD is about 50%. If you have a parent with depression, your chance of having depression is about 25%. But just like all of the other statistics, they don't tell the whole story. Number 5. Economics and education. Statistics show that people with less education, less economic stability, and less insurance coverage are more likely to meet the criteria for MDD. It seems to make sense that people under more economic stress would be more depressed, but depression has nothing to do with your IQ or your job. It's a disease. Factors like education and economics may trigger depression symptoms or make it harder for you to find treatment. Complications of depression. Examples of complications associated with depression include excess weight or obesity, which can lead to heart disease and diabetes, pain or physical illness, alcohol or drug misuse, anxiety, panic disorder or social phobia, family conflicts, relationship difficulties, suicidal feelings, suicide attempts or suicide self-mutilation, such as cutting, premature death from medical conditions. Prevention. There's no sure way to prevent depression. However, these strategies may help. Take steps to control stress, to increase your resilience and boost your self-esteem. Reach out to family and friends, especially in times of crisis, to help you weather rough spells. Get treatment at the earliest sign of a problem to help prevent depression from worsening.